Well, in terms of the public-private partnership deals, P3 deals, I mean, the British government has for the last 2 or 3 years recognised it had a problem here. Teams of accountants have been brought in, so-called hit squads going into the trusts which are struggling. We've had an attempt to set up a bailout fund of £1.5 billion for 10 of these trusts in the greatest trouble, but which had so many strings attached that hardly any of the trusts have been able to access any of this money and make use of it. So bit by bit, I think more and more people are realising that this is a policy that doesn't deliver, but I don't think it can be reformed. I think it is fundamentally flawed. And in fact, the chief executive of the regulator of hospitals, Monitor, which is he's actually a former director of McKinsey's, the private sector management consultants. David Bennett. He has actually argued that since these P3 schemes, once they're completed, once the hospitals are up and running, the schemes are quite often traded now in the stock market. He's saying, well, maybe in some cases the best thing to do is just buy them back, at market prices, because the market price might actually possibly go down a bit, but buy them back rather than continue to pay the contracts out. So, if he's saying it, I think you have to recognise the government has a bit, and we have a bit of a problem dealing with them. And what I generally think that Canada should learn is that, these schemes have been rushed into. The British government is leading the world in some of these reforms, so-called reforms, without any evidence that they're going to work, disregarding the evidence where it doesn't work. And I do think that Canadians who have got as much to lose by the loss of erosion of Medicare as we have from the NHS really need to learn from this example. It's dumb enough to make a poor policy once, but to actually then replicate it when all the evidence is it doesn't work, and to replicate it in conditions where nobody's pressing you to do so is just absolutely absurd. And really it is the case that public sector funding, public sector provision is the most efficient and effective way to deliver health care. It's the most equitable. It gives you the most scope to plan and allocate resources according to need. If you start to break that up, you replace it with something that's not as good. And that, I think people just need to bear that in mind and just, don't do it here. Just don't do it here.